Welcome back to the show Talk with Your Doc, and we have Dr. Scott Cassie with us. We are learning about bariatric surgeries from him. Dr. Cassie, you were mentioning about the changes in the diet required, and first we start with the soft liquid diet, and then semi-solid diet, and then we have regular diet. Now, what are the other lifestyle changes needed after the surgery other than the diet?
Sure. The main things would be these patients are dependent on vitamins post-operatively, so a daily vitamin that's set out by our dietitians, and they have to make sure they religiously follow that. They do have to take some antacid pills for the first 6 months as well to prevent ulcers. Beyond that, of course, we encourage exercise on a daily basis to make sure we're helping to maximize weight loss and keep that weight off.
Right.
And those are really are the big changes. We do a lot of work through the dietitians with the patients on mindful eating, so being aware of why they're eating, why they're taking in what they are, and as well stress management. As you know, many of us will use food anytime we're stressed, and it's no different with our patients. And so there's a lot of work with that to avoid overeating for reasons other than hunger and nourishment.
Right. Now, you were mentioning about dumping syndrome. Can you please tell us something about this syndrome?
Sure. It's, I would say, largely historical nowadays because we know enough about it. Typically, if you've had a gastric bypass or any form of gastric resection for a tumor, because of the reconstruction that we do, if you're eating foods that are high in sugars or really sweet foods, can evoke a fairly unpleasant response in terms of some cramping, discomfort. It can affect your blood sugar levels. It can be quite unpleasant. And so this is something that was a big problem in the past. Now there's so much education about it, and specifically in the clinic when they work with the dietitians, and there's so much education for the patients, we don't really hear much about it anymore. And patients will experience it once or twice, and they know which foods to avoid.
So which foods to be avoided after the surgery?
After the surgery, I mean, it's basically anything we consider unhealthy in normal life. But obviously the sweets, the high fat, high saturated fat, trans fats, those types of things. But the sugary foods are the big ones, and those are the ones that will give them the dumping syndrome.
So fruits, vegetables are really good.
For sure, exactly. Yeah, normal, high fiber, healthy diet.
Right. Now, after the surgery, with the change in the lifestyle and diet and exercise, what are the changes in the physical appearance of the patient, and how does he cope up with those things?
Sure. There is always some issues with some hair loss, and the amount varies between patients, and usually it does slow down. It can be a bit stressful on some patients up front, but it usually does slow down. It's not a long-term problem. There can be some changes in temperature regulation on occasion if they're having very quick weight loss. And then the biggest thing, obviously, as they lose weight, there will be some excess skin. And it's difficult to predict what areas will be affected. Certainly the pannus or the belly is the most common.
So it becomes loose skin.
Exactly, loose skin, and it can become a bit of a hindrance for them. And so we do have patients who seek out plastic surgery. We usually tell them to wait at least a year or two post-op so they've maximized that weight loss.
Right.
And on occasion, there are even patients who want other areas of the body, say the arms and legs, and get what we call body contouring surgery. And we're fortunate enough to have that offered here now with our plastic surgery department, is able to do that here in the city as well.
So are all these surgeries covered by the insurance or OHIP? Or?
Sure. So the bariatric surgeries are. So anything, as long as you meet those criteria that we talked about earlier, then you're a potential candidate, and anything that's done here in Ontario is covered by OHIP.
Okay.
There are some out-of-pocket costs for the patient in terms of the weight loss shakes beforehand, and in terms of the vitamins afterwards. You need to make sure the patient can afford that, but the operation itself is covered. In terms of the body contouring and what we call the paniculectomy, that's an area I can't comment on as much, but most of that, from my understanding, is more out-of-pocket cost.
Okay.
If the paniculectomy is deemed to be medically necessary by the plastic surgeon, then there is coverage available.
Covered, right. Now, how about the support from the family, social support, social relationship? What is the impact of that on the surgery?
Sure. I mean, that's a profound impact. For most patients, we find if they have strong relationships going in, those relationships don't change post-operatively. It's a huge support for these patients, and we do find there's a nice network of patients online right now that from the area who all work together, and so they all have social support amongst themselves for sure, but amongst family as well. It can be difficult for them for sure in some cases. So this is something that attracts a lot of attention when they're losing weight, and it may be attention they're not used to, and so they do work with our psychologists to make sure that they can adapt to this and adapt to the new attention that they encounter from the weight loss itself. And as well, although most of the experiences are very positive, you have to be aware that their social network, some of those individuals may be obese as well. And so occasionally there may be some negative impacts in terms of if a loved one or a partner is not experiencing the same weight loss and the same success, there can be some hard feelings, and it may be difficult for them as well. And so that's why we have psychologists and social workers in our clinic who are available to deal with these patients post-operatively if necessary.
Right. Now, after the surgery, if there is a very good amount of weight loss and there is a change in the external appearance, how is the change in the confidence level of the person who is undergoing this surgery?
Sure. In general, it's very profound, and that's one of the most satisfying aspects of the job, to be honest with you. To be honest, it really depends on the individual. Their weight doesn't really bother them. Preoperatively, they just want to lose weight to be healthier. But there are certain individuals who are very negatively impacted, either for social reasons or even physical reasons. Their weight actually limits them from doing certain activities. And for some of these patients, when they come back a year later, and some of them, I just ran into a patient the other day who's now competitive in CrossFit, and she's lost half her body weight and is doing tremendously well. And most times the patients eventually at some point during the course of follow-up will tell us that they have their life back. They're doing activities they haven't done in years. They're doing things they dreamed of doing in the past and they've never been able to. And so it's a very gratifying aspect of the procedure.
Huge boost in the self-confidence probably.
For sure, no question at all. Yeah.
Now, to reach up to the stage of bariatric surgery, one has to go through the family doctor. And what is the steps involved in all this surgery? Yeah,
so in general, at least here in Canada, it's a referral process. So the family doctor, any primary care physician, nurse practitioner can make a referral. Everything is done online. So the OBN, or the Ontario Bariatric Network, has an online portal. The family doctors go on there. They make a referral process through there. It's all centrally analyzed and sent back to our clinic. And anybody who fits those criteria we talked about is at least assessed. It's a multi-step process. So they start by seeing an internist in the clinic to make sure there's no other medical issues that need to be sorted out. They see a dietitian, a social worker, they see a psychologist, and basically everybody has to be on board and say this patient is a good candidate, and all concerns have been taken care of before they get to see us in the office.
So how long that takes about?
In general, overall, it's a few months. Usually by the time they see us, it's probably another few months until an operation.
5 to 6 months probably?
Probably on average, yeah. If a patient, if there's any concerns raised at any of those points, they may spend a few weeks or a few months working with that individual to make sure that those concerns are alleviated and everything's taken care of before they pass them on to the next level.
And how long they have to stay in the hospital after the surgery?
Usually 2 days. So on post-operative day 2, we let them out of the hospital, assuming all their blood work and vitals are normal. If they're from more than an hour away from the city, we ask them to remain in the city for a week afterwards, because that's that concerning period for leaks and blood clots. And they check in with the clinic on post-op day 7. If everything looks good, they're allowed to go home at that point, and then we see them 1 month post-op in the office.
Okay, and then they are followed with a dietitian and psychologist.
Yep, exactly. So they get long-term follow-up for full 5 years after that.
Great. Thank you, Dr. Cassie. You gave us a lot of good information about the bariatric surgery. We really appreciate your help.
Well, thanks very much. Appreciate it.
Thank you for joining for the show. Talk with your doc. See you for the next show.